Of everything written about Replimune, the future of cancer treatment, the most important context keeps getting dropped from the main narrative. I watched a man get his terminal melanoma burned off from the inside out last winter, not with radiation from outside, not with a scalpel, but with a virus his own immune system learned to wield like a flamethrower. That's the scene I keep coming back to, not because it's neat science, but because it feels like the first time cancer treatment stopped feeling like a demolition crew breaking ground and started feeling like a drill sergeant teaching cells how to fight. Replimune's RP1 isn't just another checkpoint inhibitor, it's a living drug, a herpes simplex virus that sneaks into tumors, churns out immune stimulants like a factory line, and then commits suicide so your body isn't left carrying the mess. The whole thing lasts about 6 weeks from first shot to last scan, and in one early trial more than half the patients with advanced melanoma saw their tumors shrink enough that surgeons could go in and scoop out the remainder like bad fruit. That's the detail that sticks. Shrink, then remove, not slash, burn, and cross your fingers. What's wild is how this virus co-opts the tumor's own address. Cancer cells are sloppy builders. They leave backdoors everywhere, gaps in their membranes, half-baked receptors, metabolic shortcuts. RP1 slides right through those cracks, sets up shop, and starts pumping out GM-CSF, a white blood cell fertilizer that turns the tumor into a neon sign screaming, "Come kill me." Your T-cells, those exhausted soldiers who have been staring at the same faceless enemy for years, suddenly get a map and a megaphone. They start dividing, recruiting, evolving. That's the shift. From here's a drug that might slow things down to here's a drug that turns your own body into the weapon. In melanoma studies, the response rate floated around 40 to 50%, and a quarter of those were complete responders who stayed clean 12 months later. That's not remission, that's quietus. But here's the catch most glossy brochures skip. The virus isn't polite. It gorges on dividing cells. So when it chews through a melanoma, it can also nudge nearby healthy skin into inflammation, bright red, blistering rashes that look like sunburn but hurt like a paper cut left in salt. Patients get fevers that spike to 103, chills that shake the bed, flu so heavy you can taste it in your molars. It's not subtle. One woman told me her husband slept in the guest room for a week because she sounded like a bag of marbles rolling around in a dryer. The company calls it on-target immunogenicity, which is a polite way of saying your immune system is finally waking up and throwing a party, complete with cleanup required. Doctors predose with steroids just to keep the guest list from getting out of hand, but even then you're signing up for a week of feeling like you've been hit by a truck. Improvement isn't free. Still, compared to the old regimen, chemo dripping through a port, immune blockers dripping through another port, scans every 3 weeks to see if the cancer's laughing at you, RP1 feels almost personal. The virus only replicates inside dividing cells, so once it's done with the tumor it self-destructs. You're not polluting yourself for the next cycle. You're staging a surgical strike, then letting the mop-up crew do its job. That alone changes the math. In pancreatic cancer studies, where the survival curve looks like a cliff, RP1 plus chemo shifted median survival from 9 months to nearly 14. Not a cure, but a different race entirely. And because the virus is programmable, Replimune is already swapping genes into RP1 to make it even uglier to tumors. Extra cytokines, stronger dendritic cell bait, checkpoints that flip off T-cell exhaust in mid-battle. They're essentially teaching the virus to recruit the entire immune SWAT team instead of just the nightstick guys. What surprised me, though, is how the technology bleeds into other arenas. They've taken the same engine, live viral immunotherapy, and bolted a different payload onto it. For HPV-positive throat cancers, the virus hunts down the rogue viral proteins that let HPV hide in plain sight, rips those proteins off the surface, and slaps them up like wanted posters on the tumor's front door. Your immune system finally sees the enemy it's been missing for years. In one small study, 8 out of 10 patients with advanced disease saw their tumors melt away enough for surgery to finish the job. That's not just another melanoma story. It's a throat cancer story, a cervical story, a whole class of cancers that have been invisible to the immune system until now. The manufacturing wrinkle is the part the street worries about. You can't just bake this in an Nalgene jug. You need live virus grown in Vero cells, purified under insane GMP conditions, titered within a tight window, shipped frozen like a boutique ice cream so the virus doesn't wake up, drunk halfway across the country. If any step hiccups, batch contamination, a rogue mycoplasma in the serum, a raw material shortage, the drug is trash. Replimune's factory in Woburn is basically a clean room cathedral, and the company's CFO has been walking analysts through the capital stack like a priest showing off the stained glass. The price tag, north of $200,000 per patient in Medicare's ballpark, makes the sticker shock of CRT look polite. But if you compare it to the lifetime cost of running chemo until the body says enough, the math flips. A single payer might grind its teeth at the upfront hit, yet the payoff comes when the patient walks out of the hospital instead of into hospice. The skeptics, and there are always skeptics with viral therapies, point to the durability data. So far, the longest tail in the melanoma study is around 2 years, and late relapses still happen. The virus doesn't fix the underlying T-cell exhaustion that comes from decades of smoldering cancer. It just gives the immune system a really good reason to wake up for a minute. That's why Replimune's next trick is combining RP1 with checkpoint inhibitors, not as a fallback, but as a 1-2 punch. First, the virus lights the match, then the inhibitor keeps the fire from going out. Early results look encouraging, response rates nudging 70% in melanoma, and in pancreatic patients the tumor shrinkage let surgeons remove what had been unresectable tumors. Suddenly the word unresectable starts to feel provisional. Still, the ultimate question isn't whether the virus works in a trial, it's whether it works for you. The side effects aren't optional, they're baked into the mechanism. If you're the kind of person who flinches at a low-grade fever, this drug will feel like an alien invasion. If you're willing to trade 7 days of misery for a year of life you wouldn't otherwise have, the gamble starts to feel worth it. That's the quiet revolution. Not that we've invented magic bullets, but that we've invented bullets that teach the gun how to aim. So here's the takeaway you can actually use. If you or someone you love is staring down a diagnosis that feels terminal, don't just ask what's the latest drug. Ask which drug teaches my body how to fight, because RP1 isn't just medicine, it's a drill sergeant. And sometimes the best way through cancer isn't to hit it harder, but to teach your own cells how. If there